Welcome back, everybody, for another deep dive. This time we're going way back in time to explore Ginkgo biloba.
Oh, wow.
It's a living fossil tree that's been around since the dinosaurs.
Hmm. That's pretty incredible to think that something so ancient could hold, secrets to modern day brain health.
Yeah.
For centuries, it's been a staple in traditional Chinese medicine, but, now science is really looking at it.
Exactly. We're going beyond folklore and diving into a fascinating 2013 study
Okay.
that combined data from multiple rigorous trials, and they used the gold standard of medical research.
Right.
They used a randomized controlled trial
Yeah.
to really get to the bottom of Ginkgo biloba's potential.
So these randomized controlled trials are like the ultimate tests for any treatment.
Yeah.
Imagine two groups.
Right.
One gets ginkgo biloba, the other gets a placebo.
Okay.
And researchers watch closely to see if there's any real measurable differences.
So we're talking about hard evidence here, no hearsay.
Exactly.
We're specifically looking at ginkgo biloba's potential for neuropsychiatric disorders,
Okay.
conditions that affect the brain and mental well-being.
Right.
I have to admit I'm already intrigued. But before we get ahead of ourselves,
Sure.
what exactly is ginkgo biloba and how does it supposedly work its magic on the brain?
Well, ginkgo biloba is extracted from the leaves of the ginkgo tree,
Okay.
and it seems to be a real multitasker when it comes to brain health.
Right.
Animal studies suggest that it has a few tricks up its sleeve.
Okay. I'm all ears.
So one of its key abilities is acting as an antioxidant.
All right.
You can think of it this way. Our cells are constantly under attack
Yeah.
from these little troublemakers called free radicals.
Okay.
They're like tiny destructive ninjas. And ginkgo biloba steps in as a powerful shield, protecting those precious brain cells from damage.
So it's like the superhero for our brains fighting off those nasty free radicals.
That's a great analogy.
Yeah.
It doesn't stop there.
Right.
Ginkgo biloba is also thought to be vasoactive,
Okay.
meaning it can potentially improve blood flow. So imagine it as a kind of traffic conductor for your blood vessels,
Yeah.
helping things move along smoothly, especially in the brain.
Makes sense. Good blood flow is essential for a healthy brain.
Yeah,
I'm guessing that's where the improved cognitive function idea comes in.
exactly. But there's even more to the story.
Okay.
Ginkgo biloba also seems to influence neurotransmitters,
Right.
those chemical messengers that allow brain cells to talk to each other.
So it's not just protecting cells and improving blood flow, it's also helping those brain cells communicate more effectively.
Precisely. Research suggests it might affect levels of dopamine, serotonin, and norepinephrine.
Wow.
These are all critical players in things like mood focus and memory.
Ginkgo biloba really does sound like a multitasker. No wonder it's gained so much attention. But let's get down to the nitty-gritty.
Sure.
Does all this potential actually translate into real-world results?
Right.
How common is it to use ginkgo biloba for these conditions?
Well, it's actually one of the most widely used herbal remedies worldwide,
Wow.
especially in Europe. It's so well regarded, it's even been officially recognized as an anti-dementia treatment in Europe since 2000, right alongside conventional medications.
That's pretty impressive.
Yeah.
So it's not just some fringe remedy. It's
Yeah.
got some serious street cred in the medical world. But let's delve into that 2013 meta-analysis you mentioned.
Okay.
What did it reveal about ginkgo biloba's effectiveness for specific conditions, starting with dementia?
For dementia, the study analyzed 8 randomized controlled trials, and the results were quite promising. Ginkgo biloba consistently showed improvements in both cognition and activities of daily living compared to a placebo.
That's great news, but can you give us a sense of what those improvements actually look like?
Yeah.
Were we talking about small, subtle changes or something more noticeable?
In some trials, they used a cognitive test called the A-DADY-SCOG, which measures things like memory and language skills.
Okay.
And patients taking ginkgo biloba scored significantly better on this test compared to those taking a placebo.
Right.
And here's where it gets really interesting.
Okay. In several of the trials, ginkgo biloba performed just as well as donepezil, a commonly prescribed medication for Alzheimer's disease.
Hold on, yeah. It performed on par with a standard pharmaceutical treatment that's pretty remarkable for a natural remedy.
It is.
But you mentioned that the overall improvements in dementia were considered modest.
Yeah.
Can you explain what that means in practical terms?
Yeah, that's a crucial point.
Yeah.
While the improvements were definitely real and statistically significant,
Okay.
meaning it wasn't just random chance. The effect size wasn't always what doctors would consider clinically significant.
Okay.
In other words, while there were measurable improvements,
Right.
they might not have been large enough for people to really notice a difference in their daily lives.
So there's a difference between a statistically detectable change and a change that actually makes a real difference in how someone feels or functions.
Exactly.
That makes sense. Were there any other limitations in the dementia research? Another factor to consider is that there was quite a bit of variability in the results from study to study,
Okay.
what researchers call heterogeneity.
Right.
This suggests that individual responses to ginkgo biloba might vary.
Okay.
And factors like dosage, the specific type of dementia, or even individual differences could play a role.
So while the overall findings are positive,
Yep.
it's not a one-size-fits-all solution,
Right.
and more research is needed to understand those nuances. Now, let's shift gears and talk about schizophrenia.
Okay.
What did the meta-analysis uncover about ginkgo biloba's potential in that area?
The research on schizophrenia is a bit more limited,
Okay.
with only 3 randomized controlled trials included in the review.
All right.
However, the findings are still noteworthy. Ginkgo biloba showed a significant benefit in reducing what are known as positive symptoms of schizophrenia, things like hallucinations and delusions.
That's a really important distinction. It's not addressing all the symptoms of schizophrenia,
Right.
but specifically targeting those particularly distressing positive symptoms.
Exactly, and it's also crucial to emphasize that in these studies,
Yeah.
ginkgo biloba was used as an adjunctive therapy alongside standard antipsychotic medications,
Okay.
not as a replacement.
So potentially another tool in the treatment arsenal,
Right,
but not a solo act.
right.
What about the negative symptoms of schizophrenia? Things like apathy and social withdrawal.
Yeah.
Did ginkgo biloba have any impact there?
Unfortunately, the meta-analysis didn't find any significant effects on negative symptoms.
Okay.
So it seems like ginkgo biloba's potential benefits for schizophrenia are really focused on those positive symptoms.
Yeah.
It's almost like it's helping to quiet the noise in the brain that's causing those hallucinations and delusions.
That's a really insightful way to put it. It highlights the complexity of schizophrenia and the need for tailored treatment approaches.
Exactly.
So we've covered dementia and schizophrenia, but did the meta-analysis look at any other conditions? I'm wondering if this ancient tree's potential benefits might extend even further.
The researchers did examine studies on ginkgo biloba's effects on a range of other conditions, including autism, ADHD addiction, generalized anxiety disorder, and even tardive dyskinesia,
Wow.
a movement disorder sometimes caused by antipsychotic medications.
That's quite a diverse list. What did they find?
Unfortunately, the evidence for those conditions was pretty limited.
Oh.
There just weren't enough high-quality studies to draw any firm conclusions.
So does that mean ginkgo biloba doesn't work for those conditions, or is it more a case of we just don't know yet?
It's definitely more the latter.
Okay.
The lack of strong evidence doesn't necessarily mean that ginkgo biloba is ineffective for those conditions.
Right.
But it highlights the need for more research, especially those gold standard randomized controlled trials.
It seems like there's still so much we don't know, but that's also kind of exciting.
It is.
It leaves the door open for future discoveries. But before we get too carried away with all these potential benefits, let's talk about safety.
Yeah.
Is ginkgo biloba generally well tolerated?
That's a crucial point. And the good news is that ginkgo biloba has a very good safety track record.
Okay,
Across all the studies reviewed in the meta-analysis, it was generally well tolerated with minimal side effects.
That's reassuring to hear. It makes you wonder why this natural remedy isn't more widely discussed and considered.
That's a great question, and it speaks to the complexities of both traditional and modern medicine.
Right.
Sometimes ancient wisdom gets overlooked in the rush to embrace the latest pharmaceutical advancements.
It's almost like we've come full circle rediscovering the potential of these ancient remedies that have been used for centuries.
Yeah.
But even with a good safety profile, I know self-treating is never a good idea.
Yeah.
What would you say to listeners who might be thinking about trying ginkgo biloba?
It's always wise to talk to your doctor before starting any new supplement.
Yeah.
Especially if you have underlying health conditions or are taking medications. Ginkgo biloba could potentially interact with certain drugs, so it's best to err on the side of caution.
It's all about personalized care, right? What works for one person might not work for another.
Right.
It seems like understanding individual differences could be key to unlocking ginkgo biloba's full potential.
Absolutely. It's not a one-size-fits-all solution. Factors like genetics, lifestyle, even diet could influence how someone responds to ginkgo biloba. It's an area ripe for further research.
This reminds me of how people react differently to coffee.
Yeah.
Some can handle it like champs while others get the jitters after just a sip.
Yeah.
It makes you wonder what other factors might be at play here with ginkgo biloba.
That's a great analogy, and it highlights the fascinating interplay between nature and nurture.
Yeah.
how our genes and our environment work together to shape our health and well-being.
It's almost like we're peeling back the layers of an onion, uncovering more and more complexity as we go. But speaking of uncovering, I'm curious, what are some other promising avenues of research that could shed more light on ginkgo biloba's potential?
One really exciting area is the use of brain imaging techniques like fMRI and PET scans. These technologies allow researchers to actually see how ginkgo biloba affects brain activity in real time.
So we could actually visualize how it's impacting different brain regions and functions.
Exactly. It's like having a window into the brain, allowing us to map out the neural pathways and processes that are being influenced by ginkgo biloba.
Hmm.
This kind of research could lead to a much deeper understanding of how it works its magic,
Right.
potentially even paving the way for more targeted
I
therapies.
can already picture those colorful brain scans revealing the secrets of this ancient remedy. What other research avenues are you excited about?
Another area that's generating a lot of interest is the investigation of long-term effects.
Oh,
Many of the studies we've discussed so far have been relatively short-term.
right.
Longer-term trials could reveal whether ginkgo biloba's benefits are sustained over time and if it might offer any protection against age-related cognitive decline or neurodegenerative diseases like Alzheimer's.
That's a really compelling thought. Imagine if we could actually help prevent or delay those conditions with something as simple as a natural supplement.
It would be incredible.
What a game changer that would be.
It would indeed. And there's also a growing movement towards combining ginkgo biloba with other natural compounds or lifestyle interventions
Okay.
to see if synergistic effects can be achieved.
Right.
For example, some researchers are exploring whether ginkgo biloba might work even better when paired with exercise, a healthy diet, or even certain types of meditation.
So it's not just about the substance itself, but about how it fits into a broader picture of holistic well-being. I love that approach.
It's about moving beyond isolated treatments and embracing a more integrated approach to health.
This whole deep dive has been incredibly thought-provoking, and it's sparked a real sense of curiosity in me.
Good.
I'm eager to learn more about future research on this fascinating topic.
It's a remarkable example of how ancient wisdom and modern science can converge to potentially benefit our health.
Well, on that note, it's time for us to take a short break, but don't go anywhere. When we come back, we'll wrap up this deep dive with some final thoughts and key takeaways for you to ponder. Welcome back to our exploration of Ginkgo biloba. It feels like we've been on an incredible journey traveling through time to uncover the secrets of this ancient tree and its potential for modern brain health.
It has been a fascinating deep dive, and what's so exciting is this is just the beginning. The research on ginkgo biloba is still unfolding.
Exactly. So as we wrap up this episode,
Okay.
let's distill all this information into some key takeaways for our listeners. What are the most important points they should remember about ginkgo biloba?
First and foremost, ginkgo biloba shows real promise for both dementia and schizophrenia. For dementia, it can improve cognitive function, and for schizophrenia, it can help reduce those distressing positive symptoms like hallucinations.
But it's crucial to remember that it's not a cure-all, and it's always essential to work with a healthcare professional for personalized advice and treatment.
Absolutely, every individual is unique, and what works for one person might not work for another.
Right. The second key takeaway is that while the research on other conditions is still limited, ginkgo biloba's potential benefits might extend far beyond what we currently understand. Think about its effects on blood flow, those tiny ninjas called free radicals and those all-important neurotransmitters.
Yeah.
It's like ginkgo biloba is a master conductor orchestrating a symphony of brain activity.
That's a beautiful way to put it, and it highlights the fact that we've only just begun to tap into the vast potential of this ancient remedy.
Our third key takeaway is about safety. Ginkgo biloba has an excellent safety profile, making it a potentially valuable option for those seeking natural approaches to supporting their brain health. But again, talking to your doctor before starting any new supplement is always the best approach.
It's all about making informed decisions and finding what works best for you.
This deep dive has really underscored how much our understanding of the brain is evolving. It's like we're constantly peering deeper into this intricate, complex organ, and ginkgo biloba is just one piece of the puzzle.
It's a reminder that scientific discovery is a dynamic process. What we consider cutting edge today might be commonplace tomorrow.
So as we leave our listener to ponder all of this, I want to leave them with a final thought. If this living fossil, a tree that has witnessed millennia of history, could potentially hold keys to unlocking the mysteries of our brains, what other secrets might the natural world still be hiding?
It's a humbling thought, isn't it? It reminds us that nature still holds so many wonders waiting to be discovered.
Perhaps Ginkgo biloba is just the tip of the iceberg,
Mm.
a sign that we should pay closer attention to the wisdom of the natural world.
And with that, we'll leave you to explore further, to delve into the research, and to continue your own fascinating journey of discovery. Until next time, keep seeking, keep questioning, and keep diving deep.
Welcome back to our exploration of Ginkgo biloba. Feels like we've been on quite a journey,
Yeah.
traveling through time to uncover the secrets of this ancient tree and its potential for modern brain health.
It really has been a fascinating deep dive, and what's so exciting is that this is just the beginning.
Right.
Research on Ginkgo biloba is still unfolding with new discoveries, constantly emerging.
Exactly. So as we wrap up this episode, let's try to distill all this incredible information into some key takeaways for our listener.
Okay.
What are the most important points they should remember about Ginkgo biloba?
First and foremost, Ginkgo biloba shows real promise for both dementia and schizophrenia.
Okay.
For dementia, it can improve cognitive function,
Uh-huh.
and for schizophrenia, it can help reduce those really distressing positive symptoms like
Yeah.
hallucinations.
But it's crucial to remember that it's not a cure-all.
Right.
And it's always essential to work with a healthcare professional for personalized advice and treatment.
Absolutely. Every individual is unique,
Yeah.
and what works for one person might not work for another.
Right. The second key takeaway is that while the research on other conditions is still limited, Ginkgo biloba's potential benefits might extend far beyond what we currently understand. Think about its effects on blood flow, those tiny ninjas called free radicals, and those
Mhm.
all-important neurotransmitters.
Right.
It's like Ginkgo biloba is this master conductor orchestrating a symphony of brain activity.
Oh, that's a beautiful way to put it. And it really does highlight that we've only just begun to tap into the vast potential of this ancient remedy.
And our third key takeaway is about safety. Ginkgo biloba has an excellent safety profile,
It does.
making it a potentially really valuable option for those seeking natural approaches to supporting their brain health. But again, talking to your doctor before starting any new supplement is always the best approach.
Always good to be cautious.
Yeah, it's all about making informed decisions and finding what works best for you. This deep dive has really underscored how much our understanding of the brain is evolving.
Yeah.
It's like we're constantly peering deeper into this intricate, complex organ. And Ginkgo biloba is just one piece of the puzzle.
Yeah. It's a great reminder that scientific discovery is a dynamic process.
Right.
What we consider cutting edge today might be commonplace tomorrow.
So as we leave our listener to ponder all of this,
Yeah.
I want to leave them with a final thought.
Yeah.
If this living fossil, a tree that has witnessed millennia of history,
Right.
could potentially hold these keys to unlocking the mysteries of our brains, what other secrets might the natural world still be hiding?
Oh, that's a humbling thought, isn't it? It reminds us that nature still holds so many wonders waiting to be discovered.
Perhaps Ginkgo biloba is just the tip of the iceberg, a sign that we should pay closer attention to the wisdom of the natural world.
It very well could be.
And with that, we'll leave you to explore further, to delve into the research, and to continue your own fascinating journey of discovery. Until next time, keep seeking, keep questioning, and keep diving deep.